Hi, everyone. Thank you for joining me tonight for another episode of Behind the Mask. Tonight, obviously, we're live on YouTube. It's going to wait for a couple other people to arrive. I hope that everyone is doing well and that everyone is safe. We're obviously all on home quarantine and just trying to get through this situation. But let's get started. I want to thank you for joining me tonight. One of the main points of this Behind the Mask series that I'm doing is really to educate you, and that's the reason for the title Behind the Mask, is because I kind of want to take away the surgeon's mask and show you, why it is that I do the things that I do, and the reasoning for that. I like to educate. That's always been a part of my surgical training, teaching other residents and medical students. And so that's one of the main things I want to show is why I do the things that I do. I prefer to do a tummy tuck before I do a BBL, which is, unusual. I don't use implants in all patients. I don't very often do mini tummy tucks. I usually do full tummy tucks. And so I explain all those things, but tonight, it's not just kind of why I do what I do, but tonight I want to show you how I came to be, how come I'm doing what I do. And so I want to share with you my development as a surgeon, and I want to share with you tonight the Ogee story. And so the Ogee story really starts a long time ago. This started back in 1987, over 30 years ago, actually, when my father became sick. And we had to end up moving to, we moved to a lake house in our lake house in British Columbia, which was gorgeous, in order for him to kind of heal and get better. He was quite incapacitated. And I was still in college. And so I had time the whole 4 months of the summer off. And so what I did is I started to do all of the work that he normally did outside, with cutting the lawn and taking care of the flower beds and things like this. And I was also at the same time working in an orchard for my summer job. It was a cherry orchard and also a small vineyard. And so I tended grapes and learned a lot about gardening. And I found out that I really liked it. I loved it. And I really enjoyed that. And then when I went to medical school, obviously there was no time to do any gardening, do anything. I was bombarded with information. And so I really just didn't have the time to garden until I finished medical school and I moved to Detroit. And my wife and I had bought this small house, and it was built in 1954. It was a little 2-bedroom bungalow, and it had this really cute yard. It wasn't super well maintained over the years, but it had the potential. And I was very busy in residency, but after my second year of residency, I went into the lab and did 2 years of research. And it was really during this time that I was able to start to garden again. And so what I had kind of started when my father was sick at our lake house, I was really able to do a lot, and I dove into it head first. I started to compost, I started to mulch, I started to put in flowers, irrigation systems. I became a member of the Detroit Rose Society. I was growing roses and pruning roses and dahlia, all these types of things. I loved it. I loved gardening. And you're wondering, how the hell is this going to relate to the Ogee story? Well, this is really an important part of the Ogee story. And so there was, behind my shed, there was just an unsightly area. And I had a lot of compost because I was doing a tremendous amount of composting. And so I decided, I want to put in a shade garden here. It didn't get very much sunlight, but I wanted it to be something other than just kind of this eyesore. And so I wanted to put in a shade garden. I started to read about shade plants and all of these types of things. And then one day I got a little notification from the little community center magazine saying that there were courses in gardening. And so, I was already going to meetings at Detroit Rose Society, which my wife thought was funny because I was the youngest one there. But so I took a course at this community center. It was free. And I went in, there were only probably half a dozen people there. And they all, everyone kind of said what they wanted to do, why they were there, doing what they were doing. And I told them I want to put a shade garden in. And so he talked to me, and we stayed a little bit after and went into some more detail. But he really planted in me the seed of the Ogee concept. Even before I knew it was the Ogee concept, even before I was a plastic surgeon, this is kind of where it all started, because he told me there are no straight lines in nature. And he showed these photos of these beautiful gardens and landscaping that he had done with what he called were these, S-curves. And so he was explaining these concepts of Ogee to me far before I even realized what Ogee was. And so I went home and I built the garden, and it turned out nicely. It was beautiful. I was very, very pleased. But that kind of left this indelible imprint on my brain. And it really wasn't for a long time when I was really able to get back to gardening. And so after that point, after my time in Detroit, where I did my general surgery, then I moved to North Carolina to attend Duke, where I did my plastic surgery. And, that was super busy time. I didn't have any time to do any garden. We had a new house, which was in a new neighborhood, which was really, honestly, not the best thing to do. It was all hard clay. It was poorly landed. There was really no landscaping. And so there really wasn't any opportunity for me to garden at all. But what really happened during my residency in plastic surgery that really started the whole Ogee was just a very simple paper that I read by Dr. Little. It mentioned the Ogee line in architecture. And that had been the first time that I ever heard that line. I heard that name. And what he was talking about is this facial surgery. He was talking about reconstruction or rejuvenation, doing a facelift, getting the cheek to be looking younger rather than cheek here, having the cheek come up. So he started talking about the Ogee line, the Ogee architectural line, and restoring that, but talking about it as it pertains to this line of the face. And so, I read that article, and I found it was interesting. I didn't really think a lot about it, but it registered with me. And, I even remember thinking, these ideas starting to come together when one night during plastic surgery residency, it's in our house in this new neighborhood. And my wife and I were out on the porch, as people in North Carolina tend to do. And we were looking across the street, and there was a young couple that had bought a house, very nice. They didn't have any children, and they were very enthusiastic. It was their first house. But this neighborhood really came with very poor, no landscaping. So what he did is he put a flower bed in beside his house, beside his garage. And we were kind of looking over it. And he had finished it, and I was looking there, and I said to my wife, I'm like, that flower bed that he put in just looks terrible. And my wife was like, that's a horrible thing to say to someone. He's such a nice guy. He worked so hard. And I'm like, no, I don't mean it in a mean way. I'm just saying there's something wrong with it. It's crooked. It doesn't match the garage. It doesn't look very good. And then all of a sudden, I kind of had this sort of memory starting to get jogged about this course that I took years ago about landscaping, and that there's no straight line in nature. This landscape architect told me that. He was wearing a plaid shirt and blue jeans and boots, but he knew there's no straight line in nature. And he's the one that started talking about the S-curves. And so then the next kind of stage in the development of this Ogee story is I went and I started practice. I finished up at Duke, and then I stayed in North Carolina. I started my own practice. Well, obviously, liposuction is a very popular procedure. So I started to do a lot of liposuction, and it was super boring. I hated it. It was just a mechanical removal of fat. And I didn't enjoy it. I didn't like it. To be honest with you, when I looked at my before and afters, which is something I still do today, that's how surgeons get better and improve and look at things. I didn't really like my before and after photos. I mean, some patients were better than others, but in general, I really wasn't that happy. But then something monumental happened to me. And this was really the defining moment, is I started to do liposuction patients on their side. And so I started to be able to get some of the deep fat around the hip, and I started to get this contour. And that's when I started to think about the Ogee line. I never called it that. It never solidified. It was never, aha, this is the Ogee. But now all of these things started coming together with my time in the orchard, my time in the summer working at my house and putting the shade garden in, the landscaping, looking at my neighbor's yard, thinking about the paper with the Ogee. All of these things were kind of starting to come together a little bit more. And I didn't know that it was the Ogee, but I knew that I really liked doing liposuction a lot better. And I really started to get better results. And so that really changed the way I did things. But then the defining moment when it all came together, when the whole Ogee concept finally hit me, was 10 years ago. It was also on a Sunday night. I was preparing a talk on a PowerPoint presentation on my computer. And I used to do that quite often, do seminars and webinars and talk. You're a young surgeon, you're trying to develop your practice, trying to get patients. And so I enjoyed doing it because I did a lot of talks in the past with research. And I was putting my slides together, and I was kind of coming up with ways, well, how can I really express what I'm trying to create, what I'm trying to do? And then all of these things came raining down on me. All of the things, the Ogee shape, the gardener, the beds, the flower beds, all of that. And that's when I came up with this is what I'm really doing. I didn't realize what I was doing, but this is what I've been doing. And so I started to look at photos about gardening and all of these things that kind of came flooding back, and I put them into my slide presentation. And it really resonated well with the audience members because they could understand. It's one thing to understand about just liposuction getting a prettier shape, but it's another to really kind of tangibly see, I see, this is nature. There's no straight lines in nature. The body's nature. The body's really maybe the most beautiful part of nature, and starting to see these shapes. And that's really when it all came together. The final piece of the puzzle came when I started to do BBLs, because the original Ogee that I had described in my mind, in my eye, was starting high in the back, coming all the way down to the front of the abdomen. Then when I started to do BBLs, I was like, wow, there's another Ogee line here. It's the same place. It starts high in the back. It comes down, but now it starts to come out in the hip. So my original BBLs, they didn't have any hips because I just did liposuction around the waist and put the fat in and got a larger butt. It wasn't until I started to graft the hips, because I was following an imaginary Ogee line in my mind, that I started to get what are now kind of characteristically my shapes, because I'm just following the Ogee line. And so that is the whole Ogee story. Way back, started in 1987 when I was a kid working in an orchard, working in a vineyard, pruning grapes. And these thoughts were just starting to kind of percolate, and going through the whole process of nature and landscape and gardening, listening to other surgeons, looking at my before and after photos, and then it really kind of all congealed. And now I don't think I could live without it. I see the Ogee line every single day, all the time. People joke with me. My wife will joke with me. Somebody sent me something the other day in a DM through Instagram talking about, oh, here's a picture of an Ogee. I'm like, welcome to my world. I see this all the time. So that's the Ogee story. I really appreciate you watching. I know it gets long-winded. If you ask me a question, it's usually going to be fairly long-winded, but I'm happy to answer any questions that you have now. If you'd like to see further videos that I'm producing on YouTube, please subscribe to my channel and also hit the little bell for notifications. But I'm happy if you want to leave me a question. I'm happy to answer any questions that you have. Here we are. Yeah, well, so a question is talking about, you know, round 2 versus round 1, and the nice thing about Instagram is I get a lot of DMs on Instagram, and so I kind of really get sort of a flavor of what people are wanting to know. And a lot, you know, I got a few comments or more than a few direct messages yesterday about this one post asking, you know, well, did she have a tummy tuck? Did she have a round 2? Did she have polymers? Did she have, you know, all these types of things? And I'm like, no, this was just a round 1 BBL. I mean, she looks fantastic. But when I do a BBL, I'm not planning on doing other rounds of a BBL. It's not as if I go into it with a game plan like, okay, here's going to be round 1. And now in round 2, you know, we're going to do these types of things. So it's not that way. I only plan on doing a round 1. Where the round 2 comes into it is a lot of time is with my correction of things that patients aren't happy with their round 1. And so that's typically for me, what I see is a squirt around. And so a lot of times the liposuction is not performed high up in the butt. And so you get this tombstone, higher kind of square deformity, and there's a lot of fat left in the upper back. And as I just explained with my Ogee story, is in order to get that Ogee line, it has to start up high in the back. So I liposuck up high in the back by the scapula, by the bra fat, all in that area. If you don't, you get what I call a butterfly look. You get too much fat in the upper part of the back, and then you kind of get too much fat in the upper part of the butt. And it sort of, you know, looks like a butterfly to me. But you know, if you want to send me some DMs, then I'm happy to look at you from in terms of going from round 1 to round 2. That's a good question. Is there a limit to how much fat I can add for hips? There is. You know, I get a lot of questions about volume and how many cc's. Honestly, I hate those questions. They're totally irrelevant to me. They're of no value. I mean, I really don't care if I put 700 cc's or if I put, you know, 2 liters in. It doesn't matter. It's all about the shape. But in terms of the amount of fat to the hip, you have to have some fat there now in order for me to put more fat in. So the reason is because those little fat cells that I'm putting in, they need a place to grow. And if you don't have any fat there, and there's few patients that don't have any fat there, really can't get a hip. Most people have some fat there, but you have to at least have some fat, and the skin has to be distensible enough. It has to move enough that I'm able to grow that hip. Where can I DM me? You can DM me at my Instagram. My Instagram is Dr. William Miami. And you can DM me there. You can DM me photos. I don't do virtual consultations, but I'm happy to view still photos. So, okay, well, it's time for dinner. So thank you so much. I really appreciate you watching. And once again, subscribe to my channel for new videos and click on the little bell icon for notifications. We're going to be making quite a few more videos now on YouTube. So I look forward to seeing you again. Thank you very much. I appreciate you watching. Have a good night and stay safe.